And we're up close and personal today with Ted Doolittle, who is the healthcare advocate for the state of Connecticut. And Ted, welcome to Up Close and Personal. We're here talking to you because many people don't know about your office. And so let's start, before we go there, let's start with you. You are a Connecticut native.
Right.
And from West Cornwall. So we had a lovely time talking about Northwest Connecticut. I was sharing with Ted that he needs to get an e-bike and ride along the Housatonic River, because up in that neck of the woods there's a lot of hills, and unless you're an avid biker, you're not going to make it too far too fast. But you have had such an impressive career. I just have to talk about it a little bit. So you are a former federal prosecutor, right, specifically for Medicare and Medicaid type fraud cases.
Right.
And you have been in legal practice and law enforcement for most of your career, a Harvard graduate, and worked for the Department of Justice. How did you get to the Department of Justice?
Well, I got to the Department of Justice by first going to a great law school, UConn Law School in downtown Hartford. And then I clerked for federal judges for a couple of years in D.C. and actually a judge out in South Dakota, spent a great year out there. But that type of clerkship background enabled me to be an attractive candidate for the Department of Justice, and I went into the tax division there and handled tax fraud cases, mostly in the southeast part of the United States. So got to travel around in Mississippi and South Florida and other venues. But that's how I got to the Department of Justice.
And got a lot of experience under your belt. So when you decided to migrate back north, right, and come back to Connecticut, you were working for then Attorney General Richard Blumenthal.
That's
and
right.
Under his tutelage, you had many experiences and enjoyed that work. And specifically, what were you doing as the Assistant Attorney General?
So as you mentioned, Dick Blumenthal was still the Attorney General at that time, and I joined the office and quickly got caught up in the Enron bankruptcy scandal. If you recall, there was a quasi-public state agency called the Connecticut Resources Recovery Authority. That's the agency that collects the trash from, I think, 39 towns in central Connecticut, and they burn it to make electricity in that plant in the South Meadows, just south of Hartford. And they loaned a bunch of money to Enron, and they did it in a way that was not proper or authorized. And so Dick Blumenthal assigned me to lead a team of attorneys to go after them and try to collect as much of the $250 million that they had wrongly lost. And spent really 7 years, my whole time at the AG's office. That was my primary case, and we managed to recover a surprisingly large amount of money. I think about $150 million from various sources, Enron, and then the two law firms that had advised the authority and set up this illegal contract. Had to pay the state upwards of, I think one paid us $15 million and another paid us $20 million. So it took a bunch of years to make that happen, of course, but that was a highlight of my career there. In addition that's when I first got exposed to healthcare, starting to do, as you mentioned, Medicare and Medicaid fraud cases. And so that's how I actually got into healthcare.
So the Enron case was an enormous case,
right,
for someone coming back to Connecticut and, kind of getting your feet wet with that office. But you also had a lot of support in that office to do that, and it helped to grow your career. And so when you were working with the healthcare, Medicaid, Medicare, this office didn't exist. Because was that 2005 is when the statute required the office that you now represent?
Yeah, our office was created, Joni, by statute in 2005. However, there was a predecessor office in place called the Office of the Managed Care Ombudsman, I believe it was called. That started in 1999. But you're exactly right. In 2005 is when this state, almost uniquely, there's not many states that have this, set up an Office of the Healthcare Advocate.
Do you know what the history of that was? Why? Because if other states don't typically have that, why did Connecticut say this is important for us to have?
Yeah, well, if you remember, that was the heyday of the HMOs, the health maintenance organizations, and they were, for those of you in the audience who are younger may not recall, that was a very frustrating situation in terms of having to get permission to go to a specialist and a lot of gatekeeping there, and so those plans became fairly unpopular, and the industry actually retreated from them. But during that heyday was when this office was set up, because people started to have more problems with their health coverage in terms of claims denials and so forth around that era. So there were some, far-sighted legislators who said, let's make a permanent office so that Connecticut consumers will have this resource. And by the way, I think it's an attractive thing for Connecticut businesses as well, because it's a free service for your employees.
Yes.
So to me, it's an economic attractor and generator that the state could do much more in trying to get the word out about this free service.
And that's what we're doing today.
Right.
So we need to let you know that if you're having problems with your health care, claims that you've put in, denials, cancer claims, those kinds of issues, there's an office, and we're going to talk about it. How many staff does this office employ?
So we have a team of 18. We're composed of nurses, attorneys, paralegals, and others who are expert in the nuances of Medicare, Medicaid, commercial insurance that you get through your employer or that you bought on the Obamacare Access Health Exchange. They can, if you give us the correct, if you fill out the releases, we can represent you in a claim denial just the same way a private attorney could, except this is a service of the state of Connecticut, so it's absolutely free to you. So it's a best kept secret in state government. And one of the things to remember, Joni, is that right when you're having a problem with your health insurance, that's when you're sick, right? And that's when you're down or a loved one is down. So that's exactly the wrong time to be needing to take on the administrative burden, and that's why folks should always keep us in mind, keep us maybe number in mind or on your refrigerator or something, so that when you or a loved one gets sick, you don't have to fight the battle on two fronts. You can try to focus on getting well, and let us focus on the stupid financial administrative burdens that you're going to undergo right at that point.
Absolutely. I mean, we've talked so many times about people having to be their own healthcare advocate, right? So you're sick, you don't feel good, or you're having the emotional struggle if you have a loved one who's sick, and you're trying to juggle all of these different things, and then you get told that you're denied, or you get told that it's not going to be covered. And you just almost push that away because you think, let me just get through the emergence of what's happening.
And then the danger there is that you're going to blow a deadline, right? You're going to miss an appeal, and then you are put in the position of begging them to give you an exemption from the deadline. The better call is, if you sense that you're about to hit some type of insurance wall, call us. Get us on your case even before the thing really blows up, and we'll be there side by side with you and your family throughout the process.
How lucky for us in Connecticut that we have this, and we didn't. Many of us don't even know that we do have access to this. And the phone number and website information will be at the end of the program, scrolling at the bottom of the program for you to have. But even healthcare insurance enrollments. People that are told, they cannot be enrolled for a specific reason, is that something that your office will advocate for?
Absolutely. We actually, in terms of the enrollments on the Access Health, the way you can buy your own individual health insurance in our state, also known as Obamacare or the ACA, we have one person who does other things too, but is almost an expert, let's say, in the area, and is available to try to help you personally. And also, we have the contacts at Access Health and at their call centers and other vendors to try to escalate that matter if you're coming up on a deadline or something else urgent. So we can advise you and to an extent directly help you on Access Health Connecticut issues, but we know the landscape and we can make sure your case gets the attention it deserves.
Now, on your website, it says explanations regarding healthcare benefit program or coverage. So even if someone maybe doesn't understand correctly,
Yeah.
and I think this can happen a lot of times. Maybe you talk to the insurance company or you're reading the booklet that they give you or you're supposed to go online. Everything's online right now. And you still may have some questions.
Yeah.
Is that, if you call your office, is there someone who can maybe more easily walk you through what coverage you do have?
That's exactly the case. We do have that service, and the cases that we take range on the spectrum from something like what you're describing. Maybe somebody's never had health insurance before, they get a bill, they don't understand why they got a bill. I remember getting health insurance and it turns out that the service is covered, but they're under deductible, and they might have to have a little coaching about what a deductible is, and you got to pay the first $1,500, so it's a legitimate bill, go ahead and pay it, but once you hit that ceiling, then your insurance will kick in. That's a 5-minute call, right, to explain how health insurance works, on up to families that have been with us for years because they have a loved one who has some type of chronic situation with very expensive, very complicated care, and in those situations we have clients that we've aided for years, from not just one claim, but from claim to claim as their condition progresses.
Without giving names or, real specifics, can you give us an idea of a memorable case that you can remember and how your office was able to assist?
Yeah, sure. So, and I want to give credit right up front to our former general counsel, a man named Damian Fontanella, because he's the genius behind this case. So we had a family who needed IVF, and the couple, one of them worked for a very large Fortune 50 company. I won't mention the name, but they needed surrogacy services. IVF was covered and surrogacy wasn't covered. We took that family through all those appeals levels, and they didn't cover the surrogacy. So that was the final level of appeal. Well, Damien didn't give up, and the Office of the Healthcare Advocate doesn't give up. We then pursued that up the corporate chain and got to the head of HR for this large company and made sure that senior vice president understood that this was the benefit and this was how they were administering it for their hundreds of thousands of employees across the globe. That executive decided they weren't happy with that, and they not only covered it for that person, but they changed the policy for this large company worldwide. So that's a particularly memorable case where probably all those kids should be named after Damien, right? But we were able to really help and change not just the lives of one family, but for hundreds of thousands of folks employed by this company worldwide. So that was a particularly memorable case.
So it's not so much, we think about, the insurance company's the bad guy, and they're not covering this person and that person. That wasn't the case at all. It was, this is how it was identified that this is how they were going to cover or not cover. And once you got to that level within the organization and explained, how it should be happening, that's when the change came.
That's right. We got up to the decision maker,
Right.
explained to them, look, this denial probably was correct under the way your policy is written. Are you comfortable with that?
Right.
And the determination was, actually, we're not.
Yeah.
We're not comfortable with that, so they changed the policy.
That,
Yeah.
And you had said before we started today that, Joni, these companies don't specifically like to see a state agency phone number coming up on their caller ID all the time.
That's right.
Asking questions. And so I think that it's important to note that it's not just insurance companies wanting to deny folks coverage. It's expensive. It's an expensive business to be in. Obviously, they want their people healthy that are insureds, and there's a lot of promotion for being healthy and staying healthy because it's less expensive for the companies. And now with COVID, what are the kinds of things that you're seeing change within your office?
Well, obviously, we went remote when everybody
Yes.
else went remote. Almost completely remote. Usually we only have one person in the office, which is usually me, to make sure that there's still some hard copy mail that needs to happen. There's
Yes.
certain documents that can only be exchanged by mail, so we need somebody in there to do that. So that was a big change. But
I've heard stories about some coverages that maybe folks underwent in intensive care for COVID-related illness, and they come out with enormous bills. Have you seen that kind of thing?
We have. I will give the insurance companies quite a lot of credit, I would say, for how much they have stood up and done the right thing and covered COVID and COVID-related treatment. I'm not saying it's across the board, but generally speaking, they have done the right thing, and they do deserve credit for that. And the insurance companies often are doing the right thing, so to speak, under the way the policy is written. But sometimes that policy is unfair, and sometimes the policies are confusing and hard to understand for the consumer. And that's when you need an advocate like the Office of the Healthcare Advocate that knows. Sometimes when that insurance company says no, you might be able to get beyond that. You might be able to say, okay, I understand that we blew this deadline. We should have sent in the appeal within 30 days. Will you give us an exception in this particular instance when we can show that the family was so ill that they weren't able to attend to that matter? Then an insurance company can sometimes grant that. We know that, but you don't necessarily know that.
No.
So we have the expertise and we have the contacts, and moreover, as I said before, right when you're having these problems is often when you or a loved one is sick or injured, and you don't need these administrative headaches.
No, and you don't know that there's somewhere you can go. If you say, I've got to hire an attorney to fight this for me, what's that going to cost?
Yep.
And are there cases that you don't take on? I mean, we don't deal with disability out of this office, correct? So this isn't
That's
Social
right.
Security disability.
That's right.
Are there other things that are not part of your jurisdiction?
Yeah, you're right about the disability. We also don't do workman's compensation cases. Our statute is very clear that we have to be limited to the core health care insurance. Now, I do want to stress that the health coverage does include Medicare, it does include Medicaid, it does include TRICARE, any way that you get coverage, but we don't cover disability or workman's comp. Usually, we have also an informal $100 limit before we will actually assign an attorney or other person. That can be waived if it's a particularly important case. I can give permission to waive that. And also, I will mention that right now, this week, started on Saturday, the at-home COVID test reimbursement program started.
Yes.
I'm concerned about that, and
Tell me why.
Because the insurance companies just didn't have enough time to get ready for it. I would say this program only was initiated by the president, like shortly before Christmas, if I recall, and the insurance companies are good at what they're good at, but they're large organizations. They're not super nimble about putting up a new program in 2 weeks. And so I am concerned that folks are going to be more frustrated than you or I would like as they're trying to get these at-home COVID tests covered. You're supposed to be able to get up to 8 tests per family member, per person who's on the insurance, per month. They can limit the reimbursement to $12 per test. These are 2-packs, so that would be a $24 for a 2-pack per test. And the companies are encouraged to be able to handle it just the same way they would a pharmacy prescription, so that you could, if you were lucky enough to find that COVID test at your pharmacy, you could take it up, use your insurance card, and you wouldn't have to pay a dime. My guess is that those situations, the companies that decide they want to do it that way, that more simple way, won't have enough time for a while to set that up. So it'll be a reimbursement situation. You're going to have to save your receipts, figure out where to file your claim online or by paper, and await your check. So it's going to be a more lengthy and frustrating process than really it should be. But I know that the demand for that home test is there. That's why there's none of them in the stores anymore. People should be able to, if you can find a test available on Amazon or on Walgreens that can be mailed out to your house. Online shopping, of course, is a big thing nowadays. You should be able to get that reimbursed. But again, it's a new program. That's why I'm concerned, Joni, just because of the newness of the program, and you're asking the insurers to pivot quite quickly for these large organizations and set up all new processes. And of course, everybody thinks, why shouldn't it be easy? Well, you know, I am not, haven't operated an insurance company, but I worked in an insurance company for several years as an attorney, and I know it's complicated work, and the systems need to be changed.
And they're big systems.
They're big systems.
It's like turning the Titanic,
exactly,
you know?
Exactly. Exactly.
It's hard to, like you said, pivot on a dime,
Yep.
Especially when you're going to have so many claims coming in, and they have to have structure and how to handle all that,
right.
and
That's
what
right.
they're going to
That's
expect
right.
for people.
So my guess is that 3-4 months from now, it'll be smooth, and it'll all be smoothed out. But right now we're in the ramp-up process.
We are.
Not so dissimilar from when the ACA first started. Everybody got mad at, you know, the system for blowing up the first couple months. Well, you know, that's the way of the world, you know. Large systems take a while to get going. Once they're up and running, now you can go on Access Health. And by the way, Connecticut was blessed with one of the really smoother Access Health liftoffs from the ACA. We were praised around the nation for having a great exchange from the get-go, which is terrific. But most states didn't have that experience, and this is another new program. Obviously, this is much smaller than lifting up the whole ACA, but it's something that I think people are going to be very interested in getting those at-home COVID tests paid for, because $12 a test, $24 to $30 a box now. You know, you can't buy too many boxes on even you know, a middle class income without that feeling that pinch.
And
so
now
we got to
that
get this
people
right.
don't have to be vaccinated in order to go to work, depending on where you work. But now that nationally, you know, it was ruled that didn't have to happen, you may have to test. You may have to test every week. In order to test every week, you have to have access to test. I waited a full day for a test in a parking lot with all these other people that I thought, I couldn't do this every week. Could you imagine having to get tested every week? So if you find tests and you buy them, your insurance company does have to reimburse you for those, and you know, be patient, but continue to look at how you need to get those reimbursements, and reach out to the Office of Healthcare Advocate if you need further help with that. What is the one takeaway that you want folks to know about today, besides contact the office if they need help?
You know, you just need to know that you're not alone in this. Don't worry alone. You have a team of state employees who are ready, willing, and able to help you, paralegals, attorneys, nurses, and others. So avail yourself of this terrific opportunity to get free help for yourself or your loved ones. That's the takeaway, is remember, you have an advocate in your corner on health insurance issues.
How lucky are we? And thank you so much for coming and talking to us about your agency. And we look forward to having you back again.
Thanks so much,
For all of us at Nutmeg TV, thanks for watching.